I developed what I thought was a chest infection. I was struggling to breathe.
He examined me and it was severe. I started doing my exercises as normal and I was just out of breath. I couldn't get my breath back.
I'm Ruth, a heart failure specialist nurse. Today I'll be sitting down with consultant Dr. Wilson and heart failure patients Aaron, Gwyn, David, Glenn and Lynn to talk about their own personal experiences with heart failure.
Hello, I'm Dr. David Wilson, consultant cardiologist. Today we're going to be talking about heart failure and raising awareness of the signs and symptoms of the condition.
My name's Aaron Michael Ebanks, known as Michael. I'm from Redditch and I'm 62 years of age.
Going back to the time of the diagnosis when you were first unwell with this, what were your symptoms at that time?
It seems quite a while ago now, but I think it was about a year and a half to 2 years ago. I developed what I thought was a chest infection. I had this constant tickle and a cough that was keeping me up at night, and even lying in bed, I found it difficult to sleep. I'd lie down on my pillow, and as I was drifting off, I'd suddenly feel as though I couldn't breathe and I was suffocating. So I'd go downstairs during the night and just sit in the chair in a more upright position to help me breathe a bit more and to calm the cough down. Where I lived, the local shops were quite close, so I'd walk to the local shops, but I'd be walking back home and it was almost as though I'd describe it as I was grinding to a halt. My breathing was becoming more and more difficult and it was almost as though my joints were seizing up, and it was so strange. It was just such a weird and frightening feeling. I also noticed that my ankles and my legs were swelling up as well. I finally went to the doctors. They did kind of agree, I suppose, that I had a chest infection, but they checked my blood pressure and it was sky high.
I'm Glenn Orton, and I should be 81 next month. We are having a lot of work done on the house, so it was a little bit stressful. And I was finding I was getting out of breath more when I went upstairs. On the Saturday morning, I started doing my exercises as normal, and I was just out of breath. I couldn't get my breath back at all. I managed to get downstairs and say to my husband, something's wrong, I can't breathe. So he phoned 111, is it? And they came very quickly, put oxygen on me. I just could not breathe.
She said, "You're looking a bit pale." And I just sat down and I just slept, literally just slept really tired. She called the local surgery, they called the ambulance, and I came in and that was it. I think it was a week in hospital. Things were starting to be okay, but I was still very, very tired. And we went to Sidmouth. I literally walked about 5 or 6 miles, and when we got back to the hotel, I slept for 4 hours. So obviously there was something obviously desperately wrong. I have to be perfectly honest. Everything happened so fast. But a lot of this was brought on by the fact I had pneumonia about a month beforehand.
My name's David Borkowski. I'm 75. Breathlessness. Really, I suppose that's about it. Tired. Becoming easily tired.
Okay.
If I went long walks, I couldn't walk from the car park to the hospital without stopping.
And when you had a diagnosis of heart failure, can you remember that day?
I was in denial. I couldn't believe it. But I've been up and down. I've felt fine. I felt poorly. But I've kept it to myself, basically.
They said my left ventricle showed signs of heart failure. That was such a frightening thing to hear, to be honest with you. Again, I was thinking 60 and, this is my lot. Thinking, how much longer have I got? Just experience unable to walk or breathe, and now being told that I've got heart failure. My mum, she passed away 2.5 years ago, primarily from lung cancer, but she'd also developed heart failure as well. And I could see the difficulties she had with her breathing over a period of time. So to say I was worried is a bit of an understatement.
It was scary because I didn't know anything about heart failure other than what I'd read. No one in the family's had it. The phone rang and I thought, I just knew it was going to be him for some reason. I said, isn't this what you call heart failure? And he said, I don't really like to say it like that, but yes. Went at 3:45 on Friday. He examined me and it was severe.
Heart failure is when the heart can't pump enough blood to meet the body's needs. This can happen due to various reasons, including weakening of the heart muscle, stiffening of the heart, or problems with the valves. Heart failure is diagnosed using a blood test called a NT-proBNP and an echocardiogram. So when you're diagnosed with heart failure, it's not a case that your heart is failing, it just needs support. So you can have support in the way of medications, style changes. What tablets were you taking at the time?
We wanted me started on the tablets as soon as possible because it was Christmas. I didn't actually get them for 2 weeks, which was quite a stress. And they had to be stepped up gradually because of the side effects, he said. So I ended up on 10 milligrams of bisoprolol.
Have you been told your most recent ejection fraction?
Yes, it improved loads. It went back to normal, between 55 and 60. So I was pleased with that.
They prescribed some blood pressure tablets for me, and they said it would takes a series of coming back to the doctors and increasing the dosage and maybe giving me some other tablets. And so over a number of weeks, possibly months, I was back and forth to the doctors. They were sending me for an MRI scan to see whether there'd been any improvements with the medication I'd been on. And I had the scan and the results from my MRI scan. She said, "This is really good. This is really positive. It's like your heart's," what was the term that they use? It's repaired itself or something. I thought, wow.
Bisoprolol had been increased, and within days, I felt so tired. And so I said to him, do I have to have that dosage sort of thing? And he said, well, it's that's keeping you living longer. I thought, well, if that means I'm tired in the afternoon, so I alter my lifestyle and I do what I want to do in the morning, and in the afternoon, if I can't do anything, I'm 80. So what?
Did you start to feel better on the tablets?
The Entresto, I felt it was that was messing up my digestive system. And he said, it is made of 2 drugs. I could alter it, but this is the one that we'd like you on. So again, I thought, right, if that's the one, then, that's the one I'll take.
And were you giving any treatments other than tablets? Have you had a pacemaker or a defibrillator?
I was offered this cardio version. I've known a couple of people that it hasn't worked for, 3 people. So I had the cardio, and next thing I know, I'm fine. And I really genuinely haven't looked back since that cardio version.
There are about 1 million people in the UK with heart failure. In Worcestershire, we diagnose 2 to 3 patients a day, or over 1,000 a year with the condition. It can occur at any age, but is most common in the older people.
Looking back over the whole process, what do you think went well, and what do you think you would change? And what can you do now that you couldn't do before?
I've got a life. I've been helping Brian with his DIY. He thinks I'm 17, I think. Yeah, up and down the loft, and I do what I used to do. I'd just like to say I'm 100% over the moon with the service that I received and the backup. Perfect, can't complain.
I'm lying there thinking this feels like private healthcare. It's wonderful. I also had a heart nurse that was it weekly appointments? Yeah, I think it was weekly appointments I was attending about 12 months, and she was the one that was prescribing my medication and checking me and making sure that I was all right. Jane Wiseman, yeah, a big thank you to her. Really encouraging as well, and that's the thing as well I think that you need along the journey once you're diagnosed with heart failure, that you've got people, professionals around you. But she was really encouraging. There was a few things that she said, even regarding the medication, because there were certain medications that I was put on. And she said, oh yeah, I'm glad they're putting you on this one, because this one's been known to repair the damage that's been done to the heart. So that encouraged me in my thinking. Finally, I got the letter before coming to this interview, and it's absolutely amazing. I just, I believe with the service that's offered and the treatment that's offered, there's a possibility for anybody for their heart to completely recover and be repaired. In my circumstance, with my heart being restored back to normal operation. So I'm absolutely ecstatic and over the moon by that result. And I appreciate my health more and more. And just to encourage anybody, to be honest with you,
I'm absolutely delighted, when we go on holiday to Sidmouth or Lanzarote, and we walk and cycle something like 35 miles. The cardio version of what I've got is just brilliant. I don't suffer with any difficulty in breathing, lung capacity, anything.
It was lovely opening a letter and having good news. I mean, who could ask for better than that? Julie was really, really helpful. We'd discuss if she wanted to increase something. We'd discuss how we'd do it.
Do you have any advice to patients going through this process now?
If you have any symptoms, chest pains, seek advice. That's all I can say, really. Don't keep it to yourself.
Absolutely. There's a possibility for anybody for their heart to completely recover and be repaired. Part of that, obviously, is a positive mental attitude, because I think you become what you think as well. And it's easier said than done, because when you get kind of frightening news like I thought this was, it's easy to spiral into a dark place and worry about it constantly. But I think with the positive statements by the nurses and the doctors, all those things help.
Thank you so much for the time this morning, and thanks for coming in to speak to us.
If you are experiencing any symptoms of heart failure, such as increased shortness of breath, leg swelling, not being able to lie flat, having to use more pillows at night, picking up shortness of breath in the middle of the night, or significant amount of weight gain in a small amount of time, we would suggest that you contact your GP as soon as possible.